Welcome. Welcome to forpay.org. This is Consumers, Dr. Bengala. Thank you for joining. The topic for today is solutions for rising healthcare costs. Yes, solutions for rising healthcare costs. I'll go one at a time. Okay, number one, consumer. You can't go wrong by empowering the consumer. Guys, if you really, this is not just coming from me, it has been from several, well-known authors. If you guys really want to read a book, it's called Unlocking the Secrets of Healthcare Premium. You should read a book by Ron Bachman. I have spoken to him several times. He's amazing. He's the one who introduced the Medicare supplemental. He's the one who started this mental parity laws. He was actively involved with both Democrats and Republicans. Folks, consumers are the one will be able to lower the costs for rising healthcare costs. We have been spending so much money on the healthcare. Right now, the budget has surpassed the national defense budget for the first time. $3.8 trillion, folks, and it's going up. And every time, I see there is a inflation, it goes through the roof. So consumers, empowering the consumers is a key for lowering the healthcare costs. How can you say that? How sure are you by empowering the beauty about the consumers is if you give them the proper tools, they'll save every penny. Believe me, every penny. You give them the deductible health care policy if they are working, they are unemployed, if they have no job, they should have the tools for the deductible health insurance so where they can put money aside into the health savings of their choice. So once you have that, you are basically empowering the consumer. Even the Medicare, if Department of HHS is listening, AARP is listening, folks in Washington are listening. Folks, consumer, Medicare, don't waste your money on the middlemen and managed care organizations, medical groups. You're spending, there's a lot of money being siphoned off at the mid-level agencies, folks. We need to get rid of the mid-level agency and give that whatever monthly contributions to the consumer, not to the insurers, not to the managed service organizations. They are making tons of money by limiting the care, and consumers have no control. And they, Americans are not going to go for it. I know for sure Americans will never go for, being told where to go, what to do. It's not going to work on the long run. These medical groups, managed services organizations, days are numbered, folks. I'm telling you, even if they don't, technology is going to change it. I can guarantee you that. There's going to be a big disruption in healthcare. It's coming, folks. Irrespective of what people say in Washington, I don't care. But things are coming. Empower the consumer. Give them the proper tools. Number one is a major element in lowering as a matter of fact, I can tell you, if you empower the consumers will save every penny and the cost will go down by 50 to 60%, folks. And we can still have the best healthcare system. We still have the best, but we can keep having a best healthcare system for everyone by creating a public-private partnership and we'll talk other things, but right now I believe the consumer. Number two, providers like doctors, healthcare professionals. The number one thing the doctors are fixated on is a tort reform, because the liability laws are so bad. As a matter of fact, by doctors getting $1 million coverage, and this, the general sentiment is, oh, every doctor has $1 million coverage, so we can sue the hell out of them. Come on, folks. We need to change that. Tort reform is a major element. We need to limit the damages to $250,000, and it lowers the cost for the healthcare providers. It lowers the cost for the malpractice insurance, and I believe the jury should be healthcare professionals, not the folks from the non-professional. If they're not involved in the healthcare, they should not be sitting on the jury. They really need to be people from the healthcare profession sitting on the panel, because they understand the healthcare. Tort reform is a vital thing, and providers, the cost that's number one, the tort reform, and the other element is office expenses, medical office expenses. Folks, with the telemedicine, telehealth, the medical office expenses is going to go down dramatically. Yes, they will go down. They can go to hubs. They can be seen in a intermediary place. They don't have to have a medical office. I really don't believe healthcare professions need it. Most of the doctors, they can do telemedicine, practice competitively, and I believe that's the way to go. And the third thing is, they have to get rid of this billing system, folks. No billing. They need to get paid as they see the care. As a matter of fact, a lot of healthcare professionals will like that, because billing is a lot of, it costs a lot of money to bill and collect the revenue. As long as you get paid, most of the doctors prefer collecting the funds right as they receive the care. So that was number two, providers. We need to make easier for the providers to take care of the patients. We used to have this house calls. We don't have any, with this insurance company have come in vogue, we have no house calls, and now the telemedicine has replaced that. And very rarely we have to make house calls. If the person is really sick, yes, I would encourage the physicians to have house calls, and they get reimbursed for their house call payments. So I believe the healthcare has to be favorable to the providers, so they have to have a competition, folks. Transparency, affordability, competition is very vital for the providers. That's number two, folks. Tort reform is a major element. We need to eliminate this, lower the malpractice awards. Number three, hospitals, healthcare facilities. And what I see here is every time, I don't know what it is about healthcare when you talk about, there are too many laws, too much regulation, too much control. And we have a food industry is taken off very well. When it comes to the healthcare, there are always rules and every time they pass a new law, it costs money, folks. Every time they pass a new law, it costs. I understand HIPAA is very important, yes. Privacy laws, we have to maintain the privacy laws. But other than that, folks, this number of hospitals, tertiary care facilities, there are too many. Actually, they should be small, short stay facilities. I would like to see hospitals to short-term facilities rather than long-term facilities. All the community hospitals should be short-term, and they should have subacute beds with a nursing home. That's an ideal way to lower the cost. And deregulation. Hospitals are over-regulated, folks. They really need to. Hospital bed should not be costing $1 million. $1 million. Every new hospital bed costs. And hospital bed per stay, if you stay in the hospital per day, $12,000 a day, folks. It's not acceptable. It's not acceptable. That needs to be changed. And they need to be billing system. Again, they need to be paid as they receive the care. I don't care how you do it, but it can be done. It can be done, folks. As long as you have a deductible healthcare policy with health savings, yes, it can be done. Subacute beds. Cost of the subacute bed is around $2,000 to $3,000, whereas hospital beds, $10,000 to $12,000. We need more subacute beds in a small community with short-term facilities. We don't need big tertiary care centers in small communities. Number 3. And number 4. Pharmaceuticals and drug prices. It'll be interesting to find out, if you go to any Mexico or you go to India, there are not many regulations. There's no gag order. Here, if you go to any facility, there's a gag order, folks. Pharmacists cannot disclose prices. That is such a, they have to be more transparent. I believe transparency will lower the drug prices, and there has to be generic drugs. Every time you get a brand new drug, the cost goes through the roof. When these pharmaceuticals are taking deductions from the government, the least they can do is they have to lower the costs. They are taking advantage on both sides. They're taking advantage from the government on their R&D, and they write it off, but they don't give the benefit to the consumers. Whenever they write off, it should reflect on the drug price. It should lower the new drug cost. That's very important, folks. Pharmaceuticals, it's a big gimmick. Every time they patent the drug, even simple drugs, hydroxychloroquine, they try to make it into a hydroxychloroquine has been there for years, and they made a big deal out of on this COVID pandemic. They made and epi is a commonly used drug. Why should it cost $300, $400, $500 for epinephrine? It is something such as simple that epinephrine, even that is too expensive. So this gag order needs to go away. Drug prices need to be more transparent, and they need to be affordable. If they're spending the money on R&D, the prices of the drug should be reflected. Because they're getting the funds from they're deducting from their revenue, from whatever the expenses are. So drug prices, yes. And number 5, insurers. I've been talking a lot on the insurers, where the premiums have to be affordable. I strongly advise for you to read Unlocking the Secrets of Health Insurance Premium, folks. This opens your eyes. I'm telling you how these insurance companies want to keep it status quo. They're not interested in lowering the prices. I can bet you. They're not interested in lowering the price. As long as somebody's paying for it, they don't care. Insurers, the bottom line is profits. Yes, profits on Wall Street. They don't care if you or me or anyone else. insurers need to be consumer driven, like any other sector, folks, like home insurance, life insurance. Across the state line, competition among the insurers need to be, they have to have a competition across the state lines. They should be able to be, premiums have to be transparent, and they need to segment. The insurers refuse to do the segmentation. That is the one is driving the costs up, because if you're sick, it doesn't matter if you're young, old, male, female, your premiums are broad, and they're not segmented based on the well category. Well category, it's 68% of the folks are in well category, folks, and their claims are only 12%. And it should reflect on the premium. It should be, and especially if you're buying a deductible, it should be less than $100 if you're buying a deductible health premium. They're not doing it. And in the segmentation, folks, at-risk category, you're talking about at-risk. People who smoke, hypertension, they're at risk. Their premium should be 10% higher, and they really need attention. These are the folks who need to pay. And claims it's only like 15%, folks. You're talking about at risk. There are 12% of the population have 15% of the claims. It's not bad. As a matter of fact, the premium should not be any higher for at risk. 12% of the population are at risk. Chronic illness. This is where our major expense is in the claims. You have 15% of the population. 15% of the population. If you're talking about 300 million, you have 45 million with chronic illnesses. And their claims are 50%, 48 to 50%. This is where our major expense is. These people with chronic illnesses, if we empower the consumers, if we do the tort reform, if we are transparent on prices and deregulation, hospital industry, and deregulate, especially take away the gag laws in the pharmaceuticals, I can bet you, I'm telling you, even people with chronic, 15% of the folks have 48 to 50% of the claims. These are the folks we need to paying attention. So it comes to around, if it's 300 million, you're talking about 45 to 50 million folks have the chronic illness, and they're the one who are having most of the claims. Last but not least is catastrophic. People who are, they have a catastrophic illness for whatever it may be impending, and it could be temporary, they could be a short time. They should be able to be segmented and provide and again, there's only 12% of the folks, and their claims are also 12% folks. People with catastrophic illness are temporary, it is a time sensitive, and their premium should not be any higher. So if you segment it, insurers can make money if you segment it and if you do it the right way. And they have to be consumer driven. It has to be. And they have to have health savings incorporated in their health premium. Basically, I would like to see both health insurance and health savings under the control of the consumer, folks. This is the beauty about having a consumer-driven healthcare. If we do that, I think the way I see it, the healthcare sector is going to be disrupted, folks. It's going to be disrupted no matter what anybody says, because technology. Right now, as we speak, I can talk to my doctor. I can get my treatment plan right on your mobile phone. I can get the necessary advice. If I have a mental illness, I can talk to my doctor, and I can, do things what it's supposed to be. It's so simple for you. And Most of the answers are right on your phone. You can ask the technology is such, you will get an answer for everything right in your palm of your hand. Health information technology is mind-boggling. Information technology in healthcare, everything you ask, you can ask Siri, you can ask Cortana, you can ask Google, you name it, folks, you will find an answer. So the technology is going to change. And I believe technology will be the ultimate factor in lowering the healthcare cost with consumer empowerment. And finally, deregulation. The healthcare industry is really, it's a high time, folks. We have done this, airlines, deregulated the airlines. Look at competition in the airlines. Whereas healthcare sector, there's still consolidation, keeping the costs keep rising. There is no competition, and you really need to have deregulation. So that way, hospitals, doctors, pharmaceuticals, they all can compete, and the premiums will go down because consumer demands transparency, consumer demands affordability. Folks, if you like my points of view, you can hit that like button, subscribe, share, and make some comments. I'd love to hear from you. And this is the first part of the segment on solutions of rising healthcare costs. I'll continue to talk on this topic on a regular basis and see what we can do to improve our healthcare access to all Americans, especially folks who have nothing. That's the focus of forpay.org, which is a nonprofit, and this is nonprofit organization. This is Consumers Dr. Bengala. Thank you for listening. Love you guys. We will see you in the next episode. Goodbye and God bless.